Good Friday morning. It is October 8th. Welcome into the Morning Medical Update. It is Follow-Up Friday. We're going to get to some of those most asked questions that we did not get a chance to answer during this past week. And now you can join us live on both Facebook and YouTube. So wherever you are joining us from, we're so glad you're with us. Let's get straight to Doc Hawk with our numbers. How'd we do overnight? Good morning, by the way.
We can be social media moguls then.
Right? You can't escape.
Yeah, I mean, I think we're doing good. We should be happy and hopefully optimistic that the numbers will stay down. We certainly know the trend, the rolling 7-day average trend of cases in the Kansas City metro area is staying low, is decreasing. Here at the health system, we have 14 active infections with 5 in the ICU and 4 on the ventilators. Only one of our people that are here with active infection is fully vaccinated. We still have 36 additional patients in that recovery period. And then Hays has 8 active infections and 7 in that recovery period as well. So a total of 50. And I think we're doing good. If we can push those active infection numbers down even more, that would be great.
Relatively good numbers. So Thank you for that update. All right, let's get to some reporters. Are there any on the line? There are not. Okay, so we're going to get straight to Amanda Cackler. She is our guest. She's joining us virtually from Great Bend, Kansas, from our campus there. Amanda, she is the Director of Infection Prevention and Control here at our health system. Amanda, good morning to you. How are you?
Good morning. Doing great. Thank you.
So, thank you for joining us this morning, by the way. But we're going to get to some questions for you. But I just want to ask you, where are we seeing some of the highest cases of COVID right now? Is it more rural areas or is it urban areas?
You know, I was looking at this online last night. You can easily access this information. KDHD has some wonderful information. You can really look at this detail by county and really have a better understanding of that. You know, Johnson County, it's a pretty highly populated county, and so they're still seeing pretty high rates every day of new cases in the hundreds. However, when you look at that population-wise per 100,000, it's only about 23, 24. Where I'm in Barton County right now, and they're I want to say they were in the 70s per 100,000 per their population. So smaller numbers every day, but per their population, it's pretty high. They're not seeing very many in the hospital, but again, here when you have 2 or 3 cases that are hospitalized, and the hospital that I'm at today only has 33 beds. So about 10% when they're at a case count of 3, that's a pretty big deal for a hospital this size. I think Lynn County is still seeing quite a few every day. So it's interesting when you look at the map of the state of Kansas. You've got some areas where they've got it really well controlled, and then you've got some areas where there's still what are considered to be hot spots. I think in Wyandotte County and Johnson County and the surrounding counties of our hospital in Kansas City, it's still rates of high transmission, unfortunately.
So Dr. Hawkinson and Amanda, I have a question from Donna over at Channel 9. Her question is, a coworker and his wife went on a trip recently and could not find rapid COVID tests on Kansas Go Get Tested's website. Also, pharmacies were booked out for rapid tests. Are you seeing a shortage of testing availability as more employers are now starting to require that workers either get vaccinated or tested frequently?
Yeah. You know, I can start. Certainly, I think that we are seeing a shortage of those home tests, and I think it's, I've heard stories, I know other people who've tried to look for different pharmacies that have those home tests. We have plenty of excess testing spots available here at the health system for the PCR tests, and again, we generally get your results back to you in 24 hours or less for most people. But I think for, again, the take-home tests, I think it is very difficult to find those around the city. Again, this is just anecdotes from what I've heard. But also, I'm not aware of the other more rapid tests, such as the antigen tests that are done at the Minute clinics. Sometimes it may be harder to schedule those that day or the next day. So I think there is that heterogeneity there, those differences there. Certainly for the PCR test, we have plenty of testing spots available here at the health system for PCR. But I know for some of the things like the home antigen test, it is very difficult to find.
Amanda, what can you add to that?
Yeah, we actually have a colleague who last week developed a runny nose, little sore throat, and was able to actually call and get the test done within the same day. So I haven't heard that as an issue, at least on our campus in the Kansas City division. We have available slots, and like Dana said, you can get your results back within about 24 hours or less.
So I want to talk about staffing in hospitals.
Yeah.
We hear all the time that there's plenty of vaccine available. We want folks to get that, but not necessarily enough staff at our hospitals. What's your biggest concern right now? What are you seeing?
Yeah, I think that is something not just at our hospital, but across the country that folks are leaving healthcare, unfortunately. The pandemic has really proven to be a significant burden on folks, and they're really struggling with staying within healthcare. And it's a time where we desperately need folks to be available to take care of ill patients, both with COVID and other symptoms and health conditions. I know that there have been some healthcare workers who are not interested in getting the vaccine, and that's going to push them. I think it's a small few, but it's definitely something that is real, that some folks just aren't interested in getting the vaccine, even though mandates are coming from the government and the science that we've seen, it appears that it is really the right thing to do to keep our patients safe. And as a healthcare provider, it's sort of a responsible action. But I do think on top of a looming nursing shortage that we've already been anticipating, this is something that we have to seriously consider.
Well, we're always interested in finding out what's going on in different areas of our state. You are in Great Bend, Kansas. So are you able to provide any insight about how people there are feeling about the vaccine? Are they on the fence and hesitant, or are they willing to get vaccinated?
Well, I don't know a ton about that. I haven't spent too much time out here in the last 24 hours, just a couple of hours yesterday and then a few more hours planned today. I do know I was talking to the folks here that report their COVID vaccination numbers, and unfortunately throughout the community and in the hospital, we did not give any COVID-19 vaccine yesterday. And I think that there's plenty to give. There's just not a line of folks interested in getting the vaccine at this point. We went, me and Jill, who is an infection preventionist from the team, we were out here and we went to dinner last night in a restaurant, and we walked in with our masks on, and that doesn't seem to be the norm. There were folks looking at us like we were crazies. It was definitely, it's just a different environment. So I think there's not a line here to get the COVID-19 vaccine, although I am hearing there's a lot of folks getting their flu vaccine, which is also very important.
Well, we'll take that. That's very important for sure. Amanda, I know what you mean. When they started lifting these mask mandates and we were all still masking, I mean, we do that every day here at the health system. So popping into another city, a smaller town perhaps, I had my mask on, and so did my colleague, and I was like, why is everybody staring at me? And then it dawned on me, oh, I'm the only person wearing a mask. So I knew what it felt like. I get you.
Yeah.
So I'm so glad you're here today, because Dr. Hawkinson's with me, and I want to get to some follow-up questions. And it's always great when you're here with us to answer some of those. So let's get to it. I want to talk about the differences in masking and different types of masks: regular face masks, gaiters, N95, surgical masks. Dr. Hawkinson, I'll let you take that one. Just what's the difference in protection level?
Yeah, I mean, we know that, clinically there are differences in protection level, and we've seen this in peer-reviewed studies. However, again, for the purposes of the general public, the CDC recommendations are to have a mask, whether it's a surgical mask, whether it's a 2 to 3 layer cloth mask or an N95. They don't really make distinction there. They want you to have the mask on. And the most important part here is that the fit is good. And so the fit around the tops and the sides is the most important, so that you aren't expressing those droplets out into the environment. That is what provides the most protection to other people in your environment, and what also provides you the mask wearer protection as well.
Okay, next question is there any long-term permanent damage from those who get maybe a mild case of COVID? They don't require any major treatment or hospitalization. Have we heard any cases where someone has had some long-term, long hauler symptoms, even with a small case?
Yeah, absolutely. We've seen people who have mild cases who don't require any medical evaluation or hospitalization, who still will complain of those long haul symptoms such as fatigue or headache or even some shortness of breath and cough. So it does happen even with those mild cases. But remember, we have a little bit of data now that supports the fact that vaccines help reduce your risk or chance of getting long haul syndrome too. So it's one more reason to get vaccinated.
Amanda, should pregnant people, this is a monoclonal antibody question. We had a guest on this week, and so a lot of leftover questions about that. What impact will it have on them or the baby if a pregnant person gets monoclonal antibodies? Do you know about that?
I would probably defer to Dr. Hawkinson, but I do remember you had a guest on earlier in the week, and I know that the recommendation is that they can still prove to be valuable without harming the mother or the infant. But I would let Dr. Hawkinson weigh in further on that.
Yeah, we had our excellent guests on this week, and they certainly said, pregnant women are able to get monoclonal antibody. But I think more to the heart of this question is a pregnant woman getting COVID-19, which we know we have seen more of a mini epidemic, if you will, of pregnant women who are not vaccinated, who do have severe illness, and who do die. And so I think it's very important to go one step ahead of that question and say, instead of needing to get the monoclonal antibody, I think it continues to be important that you get vaccinated. If you are thinking of becoming pregnant or pregnant, this will serve to help reduce your risk of going to the hospital, having adverse outcomes for you or your baby. We know that it's safe. All of the obstetrics medical societies recommend it. The CDC recommends it. It is extremely important. And the other thing, Amanda and Jessica, is we have seen also headlines now about all of the orphans that have been left, not just here in the United States, but around the world because of COVID-19. So it affects families, it affects children, even if they don't get it, because we have just seen this rash of excess deaths, excess mortality because of this pandemic, because of COVID-19. But we know that it is so much preventable, and so I think it continues to be important that we say anybody who is eligible should be getting the vaccine, especially if you are pregnant or thinking of becoming pregnant.
Yeah, man, some of those stories are so heartbreaking when you hear about a husband or a wife gets it and then they leave behind that one story where they left behind 5 children. I hear those come across feeds all the time. It's really, really unfortunate. I know we don't have Dr. Alt here for this one, but because we're talking about pregnant women, I'm going to see if either of you can tackle this one. Doctors say that vaccine does not cross the placenta if you're pregnant. So how does immunity pass into an unborn baby? I've also heard doctors say that if you are pregnant and get vaccinated, you pass the vaccination properties onto your unborn baby. Mm-hmm. How does that happen without crossing the placenta?
Go ahead, Dana.
Again, so as far as the vaccine goes, really you're going to have local uptake right there where the injection is. So those muscle cells will uptake some of those lipid nanoparticles. A majority of those lipid nanoparticles are going to be uptake by the antigen-presenting cells or dendritic cells and moved to the lymph nodes. And that's why we have had that group on the breast mammography group who talked about the lymph nodes and things of that nature, because those lymph nodes in your armpit or your axillary area will enlarge, and that is the immune reaction. And really that is where a lot of the immune reaction is taking place. It's not taking place in other parts of your body. So the vaccine won't really get to other parts of your body. It won't get to the placenta. However, we know that immunity, specifically antibodies, can cross the placenta and provide protection to baby, so that when baby is born, they will have some sort of protection against whatever that may be, and that includes influenza too. Remember, pregnant women are encouraged to get influenza vaccine so that they do have some immunity so that the baby has some immunity to influenza because of those antibodies which are crossing the placenta. Same thing here for the COVID-19 vaccine. You will have those antibodies crossing the placenta to give protection to baby.
Sandy wants to know, is there a way to determine whether antibodies are from the vaccine versus having had COVID?
Well, there are tests out that look at antibodies either to spike, and again, if you have been vaccinated and never had the infection, you will only have antibodies to spike. There are also some antibody tests that look at antibodies to N protein, which is a protein that's found on the virus itself. But we don't really use those in a clinical sense for anything specific. So that while there are different antibody tests looking at spike antibody and N protein antibody, for the purposes of clinical value and judging immunity, we don't use those really in any sense of the word.
Okay, one last monoclonal question. Oh, Amanda, go ahead, please.
All right, I was just going to add to Dr. Hawkinson's point, because we do get this question a lot. Well, can't we just test for my immunity or my antibodies, and that will tell me if I need to get vaccinated? And to Dr. Hawkinson's point, there isn't a correlation that we can say, well, you have this many antibodies, which means you're protected and you won't get sick if you were to contract the COVID-19 virus. So I think it's really important for folks not to get if they think they have a certain number of antibodies, that it actually is going to prevent you from getting ill from the virus itself.
Yeah, and I'd like to piggyback on that. That's an excellent point. You know, we do use antibody tests as a correlate of protection for other diseases after vaccination. We are looking for that still, and when I say we, it means the research community. The other scientists are looking for that correlate of protection that Amanda just talked about. So hopefully one day we will be able to do that. Right now we just really haven't narrowed that down.
Okay. All right. So I have a question about long haul risk. Do we know the COVID long haul risk for those who are vaccinated, or is it the same for someone who's unvaccinated?
Amanda, anything?
You get the long haul questions.
Again, you know, I think we had this one paper, I think it was from the Lancet a few weeks ago, that showed that there was probably a 50% reduction in risk of getting long haul syndrome. Again, just a small body of work, so the number of people is small, the number of articles that we have and research articles is small, but I think that provides us with some optimism in showing that people who were vaccinated had a 50% more or more less of a chance of getting long haul syndrome compared to those that are unvaccinated. So we do believe that vaccination does reduce your risk of long haul syndrome. And again, as we stated earlier, one more reason to get vaccinated. But we expect, as more time goes on from those people that got vaccinated and got infected, that we'll have better data to support that. But right now, the early data signals do support the fact that if you were vaccinated, you likely have a less chance of getting those long haul syndrome or symptoms compared to those who are unvaccinated.
The next question is, do we know the breakthrough infection rate in those 12 to 18 years old?
So I wasn't able to find too much information on this yesterday, but I do think it's important as we are required to report breakthrough infections to the CDC. It's really limited to those folks who have been vaccinated and then do further require hospitalization or unfortunately have a death related to COVID-19. And so I want to say the actual number of cases of breakthrough infections is quite a bit lower than what maybe is used more loosely in terminology, where folks just say, oh, I have COVID and I've been vaccinated. It really, we really are more concerned with those that require hospitalization solely due to the COVID-19 infection following vaccination, which is, as you can see in our numbers today, extremely low.
Anything to add, Doc Hawk?
No.
All right. Well, you always say that never miss a chance to get a vaccine.
Absolutely.
So this question is, can I get my COVID, flu, and shingles shots all at the same time, or should I just go ahead and hold off on that shingles shot?
Yeah, I mean, I'm going to answer that question with a yes. You know, again, initially when the COVID vaccines were coming out, they wanted you to spread the COVID vaccine out from any other vaccines by 2 weeks. This was because lack of data and experience on the safety and efficacy. But so far what we have seen now, and again, this came about when the children were able to get vaccinated, those 12 and up, because we know that children need a lot of vaccine during those important times. And so now what you can do is you can receive more than one vaccine at the same visit. This would include COVID-19 vaccine, influenza vaccine, and shingles vaccine. There was an older shingles vaccine that used a live virus. Again, remember, this new shingles vaccine, Shingrix, works very, very well to reduce your risk of shingles. Anybody who is 50 and older should go get that vaccine. But it is just really a piece of the virus. So you can certainly get all of those vaccinations around the same time or at the same visit.
Okay, the next one is, I read a recent Kaiser poll that stated only about 1/3 of parents who get their kids vaccinated from 5 to 11-year-olds, that they would not do this immediately when it's available. How will this affect our community? I just want to hear both of your thoughts about that. That must be concerning. Hopefully it's higher.
Yeah, I think it really just kind of prolongs the current situation when we know that they're not currently eligible. And so the longer it is until everyone gets their vaccine, the longer we are going to be living in the conditions we are now, where we're out in masks and we are potentially not partaking in activities that we would have pre-pandemic. So I think it just prolongs that situation and gives, unfortunately, folks who are unvaccinated that opportunity for them to get ill from COVID-19. That it's not going away.
Yeah. No, I think it's sad. We would certainly like more people who are eligible to get it. We obviously know that minors, 12 and under, 11 under, they do need their parents' permission. They need to get to the office visit to get that. And we know, again, the benefits that this vaccine provides. We are going to wait for the full data set on the safety and efficacy of the vaccines for those younger ages. We all do expect that it will be pushed ahead and okayed based on the safety and efficacy data. And once that is done, we would certainly hope that more and more parents would get their children vaccinated, again, to help protect them against the disease, even if the risk is low of them going to the hospital. Protect them from going to the hospital. Help protect them from missing more days of school or participation. Protect them against the multi-system inflammatory disorder and things of that nature. So hopefully that number will change once it comes out. Again, I'm certainly thankful my children were of that age to be eligible to get the vaccine when they did, and they're doing well and did well. And any benefits that we have seen from these vaccines in whatever age group far outweigh any risks that the vaccines pose.
I'm so glad you brought that up, because I just remember the day both of your kids were here and you did it loud and proud right here on this show. And so to hear you saying it, standing right next to your kids getting the vaccine, I think that just says a whole heck of a lot. My kids fall in that younger age group, so we'll pull them up here when it's ready.
And if you remember Dr. Pahoud, early in the stages of the trials, before her child was eligible, put her child into one of the vaccine trials to get her vaccinated.
As quick as possible, any way they can get to it. So, all right. Okay, so this last question is that this person read that someone recently died after the J&J vaccine. So if this is true, do you think that it will eventually be pulled from the market?
No, I think it's important to talk through, and I know this has come up multiple times on the show and in other venues. Unfortunately, people do die, and I may or may not have anything. I don't know that there's any correlation with the person receiving the vaccine and the death. But I think it's important to acknowledge that people still get sick, people still do die, and it has absolutely nothing to do with the vaccine.
Dr. Hawkinson,
yeah,
you got anything?
I would agree. In our large population, we've heard even Kevin Alt talk about this. For instance, in the nursing home population, we know that 1,000 or more people who live in nursing facilities in the United States in any month will die. So we know there will be death, and it is unfortunate. So also in the United States, we know that a certain number of people will die every day. So the chance that somebody got a vaccine and died within a day or 2 or 5 days or a week is pretty high in the United States, when we know the amount of death that occurs in the United States from natural causes and things of that nature in any given year or any given time. We do know that there have been some adverse events linked with the Johnson & Johnson vaccine. These events are very, very small, particularly the thrombosis, the blood clotting that occurs. But now we also understand and know what to look for, how to evaluate it, diagnose it, and treat it. And so that will reduce that risk even more. There was a recent MMWR that looked at those types of things, like the Guillain-Barré syndrome, like the myocarditis, and like the venous thromboembolism issues. And the conclusion was that these events continue to be very rare, and that the benefits of the vaccines continue to far outweigh any of those risks. But I think it is important to understand and know those risks, and so that if you did get one of those vaccines, you understand that in the time period after getting the vaccine, to watch out for that. And then if you do think that there is an issue, please go to the emergency department, get evaluated, because we know how to evaluate that, we know how to treat you for that, and hopefully get treatment quick enough. But because of all these things, no, I don't think that the vaccines will be pulled from the market. Again, any of these adverse events are extremely rare compared to the maximal benefit that these vaccines offer.
All right, thank you for clearing that up. All right, that's our follow-up questions. We have time for some great questions coming in today. Dr. Hawkinson, we talked a little bit about this yesterday, and we get several questions now about transplant, COVID, and the vaccine. So if you could give us your infectious disease perspective on some of these. So Ruth has a question. There was a recent report coming from Colorado Health System that unvaccinated COVID transplant patients, will be unable to get a transplant until vaccinated. Do you know what vaccines have been required before someone gets a transplant?
Yeah, absolutely. You know, I see these types of patients in my clinic and in the hospital every week, and these include pre-transplant evaluations for hearts, for liver, for kidney, for pancreas, and before those transplants are take place, and during the pre-transplant evaluation or workup, we do require vaccination, and these include pneumonia vaccines, which include Pneumovax and Prevnar, which are, again, just pieces of the streptococcal bacteria that provide protection against invasive disease from the strep pneumoniae, which can cause severe pneumonia. They include hepatitis A and B. There is no vaccine for hepatitis C. It does include Tdap as well, which includes pertussis and tetanus as well. So there are a number of recommended and required vaccinations. Those are the biggest ones. In addition, we also do give the shingles or Shingrix vaccine, again, to provide protection, especially when you're immunosuppressed, from you getting shingles. So this has been done for a long time. These are required through most and probably all transplant programs. And why is that? Because you needing an organ is to continue having a quality of life and to continue living. It would be so shameful for you to get that organ, go through all of the surgery, the rehab, the immunosuppression, all of the things you have to do, and then your life be taken or your quality of life be decreased for something that is so easily vaccine preventable. So that is why they are required. And again, it has been going on for decades. This is nothing new. We have had this for a long time.
But this has been popping up in the news, and we're going to bring our director of transplant
Certainly
on.
For this, it has, yes.
Yeah, so we will, we're going to dive into that topic here in the next week or two. So stay tuned for that, but continue to send in your questions. So one of our YouTube viewers, Zaydid, what are you hearing about side effects from booster shots now that there is more of that in the population? Do we know any side effects of boosters?
Yeah, there's been a couple reports, and again, really the only ones are from the Pfizer vaccine. I can't remember if it was Lancet or MMWR or one of the other journals, New England Journal of Medicine maybe, but which showed really no increase in side effects above that second dose. So really similar for those first and second doses, as well as for that third dose. So that's kind of all I know and understand. And again, the safety profile continues to be the same as well.
So Amy wants to know, how common is it for people who have had COVID to continue to test positive for it? She said that she had tested positive on August 23rd, was sick, quarantined for 10 days, did all the things she was supposed to do. Then in October, had a procedure coming up, so she had to go back to get tested again, but then tested positive. So she's trying to figure out if these are just leftover symptoms. She wants to travel, so she's wanting to make travel plans, doesn't want to get stuck not being able to get home because she's testing positive. What are your thoughts?
Yeah, we certainly see that lingering positive test after someone has had COVID initially we've seen it for up to 90, 120 days. And typically if we see that in the hospital setting, if we don't know if they had COVID previously, we treat it as if it were their active infection and isolate them. However, if she knows that she tested positive previously, I think it might be August, October, it might be a little early for a real reoccurrence. And Dr. Hawkinson, I'd have you weigh in on that as well. But we do absolutely see that lingering positive test for quite some time.
So how do you know if it's lingering or if you're positive again?
I think that is difficult for us to discern. And typically, whenever, again, if we test somebody in the hospital setting and they test positive on our admission screening or a pre-procedure screening, we err on the side of caution and do go ahead and have them in that isolation for that 10-day period.
Hmm. Yeah, but I would agree though too. We really do have some protocols in place that if you do have a documented positive PCR or whatever, and throughout that, later 90 days, we really probably would not test you. Again, we're talking for more pre-procedural things. So I think it really kind of boils down to that particular hospital or health system that you're at and what are their protocols for retesting. Certainly, we know at least a minimum of 90 days we probably would not otherwise test you if you had a previous known illness time or documented PCR or antigen. So.
Do you recommend booster shots for people who are vaccinated with the J&J vaccine?
I don't think we have information right now on the J&J vaccine and the approval for the booster for that manufacturer right now.
Can you clarify this for Ruth? She said that she thought earlier that the vaccine that we're waiting on for kids was ages 6 to 11. Now it's 5 to 11. Has that changed? Has it always been 5 to 11?
Yeah, I was thinking it's been 5 to 11.
Yeah. Okay.
Yeah, I was pretty sure it's 5 to 11. They were looking at some point, or maybe one company is eventually at getting down to that 2-year-old as well. But I think for the most part, a lot of recent news is the 5 to 11. So.
Emily has a question. Is there any current research that we know about, any learnings about the role that genetics plays in the severity of COVID patients and symptoms? So she said she's hearing more and more stories of multiple family members having the same type of reaction. Do we know anything about that?
Yeah, I mean, I think there are genetic components, but it's not just one single thing like we learned in elementary school about genetics and plants and this gene and that gene. There are so many genes that interplay, but there probably is some sort of genetic component, but those types of components and everything is so granular at the molecular level that I don't think there's necessarily one specific reason, but certainly those things are being looked at, and we will learn more as time goes on. But I think there probably is some sort of genetic or immunologic component to that, but we just don't know exactly all the interplay of all the complex processes during that time.
That's an interesting question because I am hearing those stories.
Yeah, but then, again, it's not just one simple thing at this point in time. There's an interplay of many genes, many gene products, many things that go on at the cellular level.
Nancy wants to know, is there a difference between Moderna booster and Moderna third shot?
The actual makeup of the shot, I believe, is the same.
Yeah.
And the definition is not the same, though, right? We're considered people who need it because they're immunocompromised need the third shot, correct?
Like there's a different population who is eligible for that third dose than who would be eligible for just the second of the 2-part series.
Yeah.
Gotcha.
Yeah, again, if you're immune suppressed, you should get those 3 doses of mRNA vaccine. That would likely then be considered fully vaccinated. If you are not immunosuppressed right now, they are calling anything after that 2-dose mRNA series, particularly for Pfizer, a booster.
The booster. Okay.
And is there any difference? The other way I take this question is there a difference in the amount of antigen available? I think at one point they were looking at half of the amount, but I'm not sure what will eventually come out and what will be recommended for that booster shot for Moderna.
Sayori has a question. Can you speak to how participation rates impact the accuracy of pool testing? My daughter's school is doing weekly pool testing, but the participation rate in her classroom seems to be really low, and she's just curious how that might impact.
Mm-hmm.
So typically we do the pool testing to really identify those asymptomatic positive cases, or just to really better understand what that incidence rate is within that population. So I think it just you'll have to keep that in mind. If only half of the class is participating, I don't know if it necessarily, it'll change your incidence, right? Because you're not able to include all of them in that denominator. But I think it still is an important one of the many tools to try and reduce the large impact of a positive case and the impact of then of quarantining or those other folks who were exposed to be potentially, have a hospitalization or again, miss out on school days or participation in class sports sports activities.
Yeah. Mm-hmm.
Trish wants to know, do you think the dosage for 12 to 16-year-olds will be adjusted since they have learned that the lower dose Pfizer dosage is safe and efficacious for 5 to 11-year-old kids?
I think all of the trials were done with the current dose, so I'm not sure that they're going to go back and change that for any reason. But the trials for these, when they did their dose finding, it looks like it was that reduced dose. So I don't anticipate that they're going to change that for that age group, but they certainly could.
Any thoughts, Amanda?
No. Nothing to add. He's spot
Nothing
on.
to add. Okay, so we've gotten to all of our questions for today. So, Amanda, I want to go back out to you and just get some final thoughts as we head into this weekend. What do you want us to know? What's your message?
Yeah, I think my message stays the same every week that you have me on here. Do everything that you can to keep your community safe. And if you haven't been vaccinated, there is plenty of vaccine out there. So go and do that. It should be lovely weather, I think, this weekend. So hopefully you can do something outside.
That sounds good. And we're going to keep having you back on so you can share the exact same message. So thank you. We appreciate it. And yeah, okay. Be safe and safe, Ben. Come back to us safely. See you next week. All right. Dr. Hawkinson, final thoughts as we head to the weekend?
Again, I think we have seen that our rolling 7-day average of cases in the metro area is going down. More importantly, I believe all of our hospital numbers are going down. That is important. We know that really the hospital numbers are probably the bellwether of really how the cases are going. So with everything going down, that's a great time to jump on overall vaccination rates. Please, if you haven't got vaccinated, go get vaccinated today or this weekend. That'll give you another reason maybe to not have to do your honey-do list, and you can stay in and recover, watch some college football, watch the Chiefs on Sunday night, but just please overall, go get vaccinated.
That sounds like a plan. Thank you both, and thank you all for being with us this entire week. Monday, we discuss personal services for those battling cancer, particularly breast cancer. We'll take you live to Missy's Boutique, a special shop at our Westwood Cancer Center created in the memory of two very special women who lost their battle. You'll meet the extraordinary woman who keeps their memory alive by inspiring other women to fight on. That's Monday, starting at 8. Have a fantastic and safe weekend. Thanks for being with us.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.